I've been interested in global approaches to health for many years before getting into medical school due to my travels around the world and realizing that there's many approaches to optimum health. And one way to really bring that to patients is to try to incorporate it in where they're currently getting their care. And Scripps seem to be a great environment and very open to utilizing all aspects of integrative approaches to optimize care in addition to conventional care. And so that's why I've been at Scripps since 2001. Our practice tends to be different than a number of other practices that incorporate integrative care or complementary care in that we are housed within the larger Scripps system. And I think that has a lot of advantages because it allows me and my team to know exactly what a patient is incorporating already from a conventional standpoint, so I can help optimize that with use of things like exercise, mind-body therapies, acupuncture, etc. And it really creates a full integrative system as opposed to more fragmented care that might happen if a patient is going to multiple providers and multiple private and large systems. So it really helps to make the care efficient and optimal. I think it's very important to approach pain from an integrative standpoint because we are at the forefront of trying to figure out really as a nation how to optimally treat pain. For many decades, really, we've had a procedurally heavy and medication heavy approach, which for some has been completely appropriate. But for many who have more chronic pain as well as pain that's really complicated by things like depression, insomnia, fatigue, and other chronic diseases, it's really important to really understand how we can use the larger toolbox to help that very specific type of chronic pain. The most important way I collaborate with other clinicians is when a patient comes in with a very complex case. So they may be presenting with, let's say, a headache, but in other cases, aspects of their care may be complicated with things like depression, insomnia, respiratory problems, cardiac problems, and it's very comforting for me to be able to contact those providers and make sure those other areas are efficiently and confidently being treated so that when a patient comes to me, we can make sure that we're not just dealing with one silo, that we're really treating the whole patient.